Bleeding during pregnancy. How much bleeding during pregnancy is normal? Vaginal bleeding during pregnancy can occur frequently in the first trimester of pregnancy, and may not be a sign of problems. However, bleeding that occurs in the second and third trimester of pregnancy can often be a sign of a possible complication. Bleeding can be caused by a number of potential reasons. Some basic things to know about bleeding. If you are bleeding, you should always wear a pad or panty liner, so that you can monitor how much you are bleeding and what type of bleeding you are experiencing. You should never wear a tampon or introduce anything else into the vaginal area, such as douche or sexual intercourse, if you are currently experiencing bleeding. If you are also experiencing any of the other symptoms mentioned below in connection with a possible complication, you should contact your healthcare provider immediately. First half of pregnancy. Miscarriage. Bleeding can be a sign of miscarriage, but does not mean that miscarriage is imminent. Studies show that anywhere from 20 to 30% of women experience some degree of bleeding in early pregnancy. Approximately half of pregnant women who bleed do not have miscarriages. Approximately 15 to 20% of all pregnancies result in a miscarriage, and the majority occur during the first 12 weeks. Signs of miscarriage include vaginal bleeding, cramping pain felt low in the stomach, stronger than menstrual cramps, tissue passing through the vagina. Most miscarriages cannot be prevented. They are often the body's way of dealing with an unhealthy pregnancy that was not developing. A miscarriage does not mean that you cannot have a future healthy pregnancy or that you yourself are not healthy. Ectopic pregnancies. Ectopic pregnancies are pregnancies that implant somewhere outside the uterus. The fallopian tube accounts for the majority of ectopic pregnancies. Ectopic pregnancies are less common than miscarriages, occurring in 1 of 60 pregnancies. Signs of ectopic pregnancies: cramping pain felt low in the stomach, usually stronger than menstrual cramps. Sharp pain in the abdominal area. Low levels of HCG. Vaginal bleeding.